Welcome everybody to Conversations in Lung Cancer Research, a TOGA podcast where we discuss the latest breakthroughs in lung cancer research, as well as treatment for Australia and New Zealand. My name is Mel Moore. I'm a medical oncologist at St Vincent's in Melbourne. Before we begin, TOGA acknowledges the traditional custodians of the land on which we live and work. We pay our respects to their elders, past, present and emerging. We also extend that respect to all Indigenous people. In today's episode, we're lucky enough to be joined by Associate Professor Surein Arulananda. Surein is the Interim Director of Medical Oncology and Thoracic Oncology, Trials Lead at Monash Health. He holds an Adjunct Associate Professor position with Monash University. He completed a PhD in novel therapeutics in mesothelioma and a postdoctoral fellowship at the Dana-Farber Cancer Institute in 2022. He is the primary investigator, including Australian lead on multiple phase 1 to 3 commercial, collaborative and academic studies. He is the Associate Editor for the Journal of Thoracic Oncology Clinical Research Reports published by the SCLC. He has published over 40 peer-reviewed manuscripts, been an invited speaker both nationally and internationally, and has been successful at competitive grant funding. He is the Small Cell Cancer and Mesothelioma Scientific Committee co-chair for TOGA and is a member of the SCLC Basic and Translational Science Committee. He's also the convener of this year's TOGA annual scientific meeting. I'd like to welcome Surein to TOGA's Conversation in Lung Cancer Research podcast. Surein, thank you for being here today for the podcast.
No, thanks for having me here today, Mel.
So Surein, we start pretty gently. I usually start these by just asking people to give a bit of a background of how they've got to where they are, what their sort of, I guess, education and career path has been, and we'll go from there.
Sure. So I guess I did university at the University of Melbourne. And then during that time, I had my preclinical rotations at the Austin Hospital. So naturally, I stayed back and I did my internship. I got into physician training. So I did that for 3 years. And then I got into the medical oncology program, to which I did for 3 years as well. And that final year, I did a fellowship in lung cancer and melanoma back at the Austin. Subsequently, followed that up with a laboratory-based PhD, which I did at the Olivia Newton-John Cancer Center. And then after that, I went to the Dana-Farber Cancer Center in Boston for a postdoctoral fellowship, and then came back to Melbourne in 2022 to basically work as an adult.
As a grown-up.
As a grown-up, yes.
So lots for me to go back and ask you about there, but what drew you to medical oncology?
Yeah, it's an interesting question because it was never really on my radar coming through medical school, and certainly wasn't something I ever thought I would ever be interested in. It really happened when I was an intern in Ichuka. And when I was up there, obviously we had to take care of all the patients on the wards. And there were several patients who were basically having end-of-life care. And at the time, as the solo doctor working with GPs managing these patients, there were certainly challenges that came from that. And actually, I never really dealt with a dying patient up till that point. And I realized that it was something that I had a natural affinity to in terms of communicating, especially to patients and their carers. And that really drew my intrigue. So because I was one of these people who used to suck up to admin, if you call that, I was very fortunate to get a medical oncology rotation in my second year as the first year basic physician trainee. And that really is what opened my eyes to the whole world of oncology. And back then, in fact, we're going back to what was it? Kind of the year now, sorry. But it was back at a time where we didn't really have any great therapies. It was just the day of chemotherapy. But I was also fortunate in that rotation to treat one of the first patients in the world on what was, I can't remember the code name now, for vemurafenib for melanoma. And so a young patient, go from really quite unwell to really very well within 24 hours. So I then started to really become interested in the field. I was also fortunate during the rotation to meet some really supportive mentors, specifically Paul Mitchell, and at the time, a young Tom John, who had just come back from his postdoctoral fellowship in Canada. So it all seemed very swanky and cool. So I still wasn't, I wouldn't say I was overtly convinced. It was definitely the path I was going to go down after the rotation. But then as I went through the rest of the rotations and got through my physician training, I realized that was the one I was most interested in. So I applied and got into the program. And as they say, the rest is history.
That's interesting, Surein. I guess I've got a bit of a similar experience. I went through medical school in junior years, dead set I was going to be a gastroenterologist, and sort of by accident did some relieving in oncology. And it was the same thing. I think it was the patients and those end of life and sort of tricky conversations, which for some reason I felt like I was okay at and didn't feel uncomfortable doing them. So yeah, it's funny how those patient experiences, and then as you said, you get inspired by mentors and people that you work with, and it goes from there. It's interesting, the sort of things that you think may not attract you to a specialty are the things that hook you.
Totally agree. And it's ironic because actually the specialty that was most in my head was cardiology, which is of course a far cry from a few of the things we've discussed. So no regrets.
No, that's great. That's fantastic. And so you mentioned you did a lab-based PhD. Can you elaborate a bit on that?
Yeah. So I suppose going back a few years prior to that, when I came through the medical degree at the University of Melbourne, it was an undergraduate degree. And there was a year in between, which was the Bachelor of Medical Science. And that was the year that I had the opportunity to work with sheep in a preclinical pharmacology laboratory, basically. And there I was helping the postdoc giving sheep heart attacks and then analyzing their cardiac tissue later, looking for apoptosis. So it was a fascinating experience and one that I felt that I wanted to come back to further pursue in my career. So in many ways, when I was looking at the algorithm for medical oncology as an advanced training specialty, I, of course, knew that oncology had a heavy research emphasis as well. So when I came back to the Austin to do my fellowship, I connected with Tom John pretty early on in the piece and told him that I was interested in a PhD and certainly interested in a translational PhD, which had a laboratory component, which was, of course, right down his alley. Look, certainly, I think that, it's a different world going back into the lab after having done so many clinical years, different ways of interacting and thinking about things. And I think that's probably one of the most fascinating things, having conversations with career scientists who sort of think about things a bit differently and sometimes may get a bit bogged down with certain details that may not be so clinically relevant. But at the same time, being able to enlighten them on where the space is clinically and being able to kind of guide their focus and which actually certainly hold my own way of thinking about things as well. So look, it was a fairly hands-on PhD, involved doing lots of preclinical work, cultures, fax essays. And then in my second and third year, I did a lot of mouse work. So I was one of the few PhD students was there doing oral gavages on mice, so being able to put medicines down their throat and measuring tumors and things. So yeah, look, it was definitely a really fascinating experience, and being able to put the science and the clinical work together was fantastic. And even something that even until today shapes the way I think about things and helps guide my management of patients.
I'm very impressed, Surein, that you worked with sheep in your BMed Sci and then backed up again for working with mice in your PhD. It didn't turn you off. So what was your actual research question?
Doing the PhD. So I guess as in most PhDs, or maybe not all PhDs, it started off being trying to work out better ways of treating mesothelioma, which we know mesothelioma is, has a high prevalence in Australia, and there are limited treatment options for this. And it sort of started off in one direction that Tom and his previous PhD student had sort of gone down, and it moved into a very fruitful collaboration with a scientist at the Olivia Newton-John Cancer Center who had a special interest in BH3 mimetics, These are drugs, you may have heard of drugs like venetoclax in hematological malignancies, and they work on that sort of BCL2 pathway, which is very much implicated in apoptosis. So it really was trying to understand that particular space in mesothelioma, looking at prognostic and predictive properties, and then testing drugs essentially both in cell models and in mouse models as well, and trying to understand if there was a pathway forward towards bringing these drugs into the clinic. So it was a really nice bench to, not quite bedside, but from, sort of throughout the whole paradigm of preclinical drug development, if you like.
Absolutely. And do you still have links with a lab with some translational work, or are you purely clinical now?
Oh, no. So I definitely would like to consider myself a translational scientist or translational medical oncologist. I think something that I learned on pretty quickly is that, when one goes down this path, they have two options. Either you end up focusing on the lab and having some clinical work, or the other way around. And I suppose I was always modeling my career after Tom. And, I think he had a very nice balance of how he was able to have that clinical focus, but also have, a strong collaborative experience with scientists and be able to do the preclinical work that he wants to do. So yes, I am currently in close collaboration with two excellent scientists who have a lot of interest in lung cancer at the Hudson Institute, which is where I work at. And we have some really nice collaborations going together. We started a biobanking program. So it's both a tissue and a blood-based biobanking program. And we already have seen some nice, fruitful grants and papers come out from that collaboration. So certainly been able to continue doing the science in the way that I would like to do, given that I have a heavy clinical load as well.
I guess that was my next question. How do you find that balance?
I don't really know what balance is, but look, I mean, I think, it just comes down to, I'm one of these people who just says yes to everything, Mel, and you kind of just say yes and then just try to fit everything around it. So that's, I don't have any smart answers beyond the fact that I just try and make it all work. We have 24 hours in a day, probably not enough, but, we'll see where we land before I have to draw back.
You obviously enjoy it to say yes to all those things.
Oh, it's certainly an exhilarating thing, and it's sort of a very varied career as well, right? Because I get to go to the clinic, I get to enjoy taking care of patients in the standard of care space. I get to do lots of clinical trials, so I get to manage patients on some of these newer therapies. I get opportunities to do quite a lot of work with TOGA, so I'm the small cell mesothelioma scientific co-chair, so there's been a fantastic experience actually being able to contribute that way. And then, of course, I'm also on one of the SCLC committees, so I've got to contribute that way as well. And then I've got various collaborations with the pharmaceutical industry on giving talks and ad boards and things. So I get to do different things, and I think that because everything is so different, each one gives me more variety and creativity in my day.
Yeah, it keeps it fresh.
Yes.
Yeah. So I'm just going to take you back to your time in Boston. How did that come about, and what made you pursue some time overseas like that?
Yeah. I mean, I guess when I was sort of mapping out my career initially, I was thinking that, what I really wanted to do was to be able to further my experience overseas and to get different perspectives and actually just to get a whole totally different experience, really. I found early on in life that I do enjoy traveling. I didn't think I did, but I do enjoy traveling. So I thought that would be a good experience to do that. And when I met my wife, she had also stayed overseas in the US for a while, and she stayed in Singapore for a while. So she really also had that. So we were quite aligned in our interest in doing something along those lines. And when I was in my final year of my PhD, Tom, who had gone overseas, was incredibly supportive of that notion. And we're looking at a few different options. And that was one of the options, to go to the Dana-Farber. And I guess maybe it's a bit of a boyhood dream to, go to Harvard, right? So, that all sort of came together, and it was a no-brainer for me. Of course, going there And then COVID lockdown starting 3 days after landing in the US wasn't exactly part of the plan. But, we navigated it the best way we could.
That's amazing, because I know of some people that didn't actually make it to their overseas fellowships. They missed that window. So well done getting there. That must have posed some challenges once you're over there.
Oh, certainly, because we got there, we were able to get the place we wanted to stay in. And then the lockdown started and I wasn't able to go into the lab for about 3 months. So there was a long gap there. And when you're in a foreign country and, it's going through the pandemic was certainly a different experience. But once the lockdown in Boston sort of stopped, then the lab was very good at us being able to come in for certain hours and whatnot. So it worked. And, we actually had our second child there. So my second child was born a few months before we came back. So now we have long-term ties to the US.
Fantastic. So you got a son with a son or a daughter, did you say?
No, son.
Son with a green card?
Son, yes, he's my ticket to the green card in the book.
And have you found that those contacts and experiences in Boston, do you still maintain those contacts and you think they've been helpful in your career to date?
Yeah, definitely. It has been incredibly helpful. In fact, I think that has in many ways spearheaded a lot of the collaborations I was able to make and things I was able to do when I came back to Australia. Because, coming back as a first year consultant, having gone through a pretty long training program, you think about it before actually getting your first consultant role. It's quite a daunting thing. And, you don't really know where to turn sometimes in terms of where you start. Like, how do I run a clinical trial? How do I get a clinical trial? And I think having those connections actually made a big difference. I mean, examples would be that when I came back, I knew I wanted to be more involved in our journal. So I was able to reach out to Alex Ajay, who is the editor for the Journal of Thoracic Oncology. And through my connection, through my postdoc time, he had caught wind of me and he got me in as an associate editor for the sister journal, JTO-CRR. And I've really enjoyed doing that. And of course, I work closely with Emily Stone, who's the editor for that journal. So that was one easy example. Other examples include being able to connect and get certain clinical trials to Monash in Australia. I think that has been fantastic as well. So certainly it's been very helpful.
Fantastic. So Surein, I think the first time I met you, and you probably don't remember this, but it was, I think, after World Lung in Singapore a few years ago. And I think I met you in the lounge, and assuming that you were on your way back to Australia as well. And you told me that, you weren't back to Australia, you were heading back to London where you were doing an MBA. And I just remember feeling insanely jealous of you because London is a city that is my favourite city in the world and it's on my bucket list to spend some time living there at some point. And I just remember peppering you with questions and talking about the cricket and I think that sort of time of year married up. Make me jealous again, Surein, and tell me some more about how that came about and fill our listeners in.
Yeah, I do remember that conversation and I think I was incredibly jet lagged as well, ironically, having never been jet lagged going to Singapore in my life. So this really started because when I had applied for a job to come back to Australia, the job that I was successful for was a deputy director position in Monash Health. And I suppose it is, some would consider unusual that your first consultant position is in, a management role really is such an early part of my career. But Eva Segalov, who at the time was the head of unit, I can only consider her a very creative leader. And I suppose she saw something in me that she liked. After being successful for the job, where Eva was very confident that I would be able to achieve the goals as the deputy director, she very casually slipped in that it would be perhaps my best interest to get more experience. And when I asked her what that meant, she said maybe some extra education. So as we were troubleshooting this together, I decided to do a certificate of leadership through Harvard Business School because, of course, I was there in the US at the time. And after I completed that, I got an invitation from the business school to consider an MBA there. So I was having a very casual, not serious, jovial conversation with Eva, where I said, can you imagine me doing more study. And she was deadpan serious and said, I should do it.
Wow.
So
you're not even in Australia yet. You're still in Boston.
Still in Boston, about 2 or 3 months before coming back, wife heavily pregnant, made an interesting decision to look into that. And then I was accepted by Melbourne University. So I got back, and within a few weeks of coming back, actually, and taking on my position at Monash Health, I also started a part-time MBA at the University of Melbourne. The truth is that when I used to think of what business was, and I think many people who are not sort of necessarily that think business equals making money, but actually it really isn't. And it was a really fascinating experience because I was able to be part of a large group of individuals who came from a varied backgrounds. In fact, some of my best friends are from that MBA class. We still catch up every few months. One works in a bank, for instance. One works as a data analyst at Bunnings, and one is now a consultant for BCG. It's just been fascinating to get to know different people. And I think what was even more fascinating to know is that often in healthcare, we sit here thinking, we have all these issues with resources. We may have challenges with career progression, just talked about, work-life balance, and maybe some of us may have, difficult co-workers, etc. It is exactly the same in all different industries, the same challenges, the same concerns, just dressed up differently. And that's what I found really fascinating. And then the other thing I found fascinating is that a lot of the MBA is really geared towards leadership and what that looks like, and being able to train you for that. For instance, I learned that leadership isn't a one size fits all. It actually is, the good leaders are actually adaptive leaders. You can use different leadership styles for different situations. I learned about things like strategy on a page, for instance, which is a very nice way of being able to think about something. A huge thing I learned in the MBA is that it's about being able to structure a thought in a few sentences or even in a minute, and being able to get what you want to get out in that time. And that has really made a huge difference, I have to say, to the way I've been able to practice medicine and how I interact with my peers and interact with the pharmaceutical industry, just teaching me a different way of being able to think about things. For instance, and I suppose we might talk about this later, when it came to thinking through the small cell lung cancer workshop they were about to have soon, and even the TOGA ASM, I was able to bring that lens into thinking about things a little bit differently, to try things that might work and take risks. So I think that it has been a really, really fascinating experience. And I completed that 2 years in. Yes, somehow I was able to do my job. I actually did the part-time MBA. And you are alluding to London because when I first started, I told Eva, if I'm going to do this, I want the opportunity to go overseas again, because when I started, they offered this elective and I just come back from the US, and I thought, wouldn't it be great to go back to the US? And Eva, I don't know whether reluctantly or not reluctantly, said yes. But it was obviously approved by the hospital. And then when I was looking at options, I listed a whole bunch of places. I actually had a few US places above, and London was there, and I got London. And I can tell you right now, it was no consolation prize. It was such a brilliant experience going there, and we lived there for about 4 months. And yes, it was ironic I had to fly back to Singapore from London for World Lung, but it was just the best experience. I was able to do some excellent classes. In fact, in the London Business School, I was the third best negotiator in my negotiations class, and I got the top prize for the board elective as well. So worked hard and great experience.
Fantastic. So not often, but I guess there are some courses where you sort of, it's a bit tick a box. You've got to do that to advance your career. But this is actually something that's obviously been very meaningful and very practical and useful to you on a day-to-day basis.
Oh, definitely. Yes. And I'm not the sort of person that likes to take things and tick the box, because I can reassure you that doing a 2-year part-time MBA with exams every 10 weeks, and the exams are 2 to 3 hours long, and class commitments and lots of weekend assignments is not a tick the box exercise. And I was able to finish it in record time as well for a part-time MBA in 2 years. It was very much because I thoroughly enjoyed it. And it was a nice escape. I actually really miss it. I mean, I'm very busy now. Of course, I'd have no time to do it, but I really miss going to classes and talking to people and, just a bit of an escape from talking to your peers all the time, something a bit different.
Yeah. And were there other medical people in the course, or were you quite unique in that?
There were a few. I suppose what I always found interesting is that the few doctors in the course had different goals. They weren't necessarily heavy on the academic side. They were mostly trying to pursue various hospital management type roles. So I guess I was unique in that I was one of the few academics from any field who was interested in management as well.
Fantastic. Fascinating. Just going to change tack a bit now, Surein. You mentioned when talking about your inspiration for going into oncology that at the time there actually was not a lot of drug options apart from chemotherapy. What do you see that's been the biggest change in the course of your career so far, and where do you see things going in the next 5 to 10 years?
I suppose I can answer that in a few different domains. Firstly, the targeted therapy space has really avalanched. When I first started as the fellow at the Austin, we were using a drug called AZD9291. Ironically, sometimes I still call it that. That's osimertinib. So, and now it's just used commonly, but back then it was still within the confines of a phase 1 trial. So we've just seen such an avalanche in the targeted therapy space. We've seen more sophisticated next generation sequencing panels. We now have drugs for up to 10 different mutations, but not even just mutations, right? Even with EGFR mutations, we're now treating EGFR exon 20 insertions differently, and there's a plethora of drugs there. So that has been one of the biggest advances I've seen. I think we've also seen this interesting paradigm shift where we started with the concept that if you had a targeted mutation, you use an oral therapy. And now we seem to be coming back 360 degrees into perhaps using more upfront intensive therapies with intravenous therapies in combination with targeted therapy. So that's been an interesting thing to observe. Of course, we've seen a huge landscape shift with immuno-oncology and how that has really changed the landscape. I feel like in some ways we saw this huge shift up when we saw the data with the anti-PD-1 therapies. And then in some ways, if you think about it, it has really plateaued. But in the last 12 months, I've seen some very nice trials looking at other therapies like vaccine therapies, CAR T therapies, and hopefully we will start seeing that these therapies actually can make the difference. And I suppose it would be remiss of me to not say that I would argue that maybe the most personal satisfaction, having been involved in trials myself, is the change in small cell lung cancer. Because where we spoke earlier, Mel, about me accidentally in some ways falling into oncology, and perhaps maybe also accidentally falling into lung oncology because it was more driven by the mentorship that I had received from Paul Mitchell and Tom John that took me down that path. My fall into small cell lung cancer was probably even more of an accident, really. I just come back to Australia. Eva in particular was very keen for me to be involved in TOGA. I was knocking on Nick Pavlakis' door and Tom John's. And then the small cell and mesothelioma subgroup opportunity came up. And I was thinking more along the lines of I had some experience in mesothelioma, so let me go down the path. And then as it turns out, Monash has a lot of small cell lung cancer patients, an area that I hadn't really had a lot of strong interest in, only because there haven't really been a lot of drugs, as we know. And then I got approached for the Delphi 304 trial. And at the time I thought, okay, this is going to be hard work, but why not? Let's do it. Let's have a challenge. Let's admit all these small cell patients and do things that we would have never thought about doing. And of course, now we've seen the small cell space change miraculously, really, in a short space of time. So that has been a really personal satisfaction for me to have been involved, maybe not quite at the start of some of these BiTE therapies coming in, but certainly in some of the pivotal trials and now seeing a real impact on the patients.
Yeah, congratulations, Surein, because I must say, if that had come across my desk, I may well have looked at that and thought hospital admissions, CRS, ICANS, small cell. No, we might knock that one back. But that shows a degree of bravery and foresight to take that on and look where it's revolutionized treatment of small cell, really. It's amazing.
My team saw a young, ambitious, somewhat neurotic person coming in and asking them to do some crazy stuff. And I can only thank them for coming along for the ride, really.
I thought they'll give you a go, and look where it's got them. That's fantastic. So you alluded to earlier, as I did, that you are the convener of the TOGA ASM this year, and we've been both together on some local organising committee meetings. What has it meant to you to be able to take on that role, Surein?
Yeah, look, I mean, to be honest, when I was sent the email to do it, I was absolutely mind blown to get this opportunity so early in my career. Having attended some of the conferences at ALTG prior to that and TOGA, I was always in awe of how amazing these conferences run and the strong science and strong clinical talks that come out from them. And more importantly, the strong collaborations. So I'd always been, it was always like another dream of mine. At some point in my career, it'd be nice to be given an opportunity to convene a conference like the TOGA ASM. So I was definitely shocked beyond belief when I was asked to do it. So much so I went into a ball of insecurity and started calling people to check that they had asked the right person. But I think we've moved away from the insecurities. Yeah, I still don't really feel like it's real, but it's been very nice to have been part of doing it so far.
And what's been your vision or your principles in the process so far?
So I suppose what I was really hoping to achieve from this year's TOGA ASM is to create a futuristic yet practical program that would appeal to various disciplines. Hopefully, we have put together a program that will address that, and that will be very exciting for people to attend, not just for the collaboration and friendships, but really to gain a lot of educational material and hopefully opportunities for them to think about things differently as they sort of move forward back into their clinic. I think something that I felt really strongly was that, you could go away from someone who attends this conference would go away and be able to think about things differently from the time they go back to a clinic or to their jobs the next day.
Yeah, that's fantastic. And you mentioned the friendship and the collaboration. I think that's the thing I find in the lung cancer community. It is friendly and there is collegiality. So if anyone's wondering whether to register, I'm obviously biased. You're biased, Surein, because you're convening it, but they're great conferences. They're a lot of fun. It's a great chance to chat to people that you might see on podcasts or other conferences. Everyone's very approachable. So that's my little plug for the ASM. So you sort of said, Surein, this has been something that you'd wanted to do and you didn't think it would come to you so early. It feels like you've done a lot in a relatively short time in your career. What else is on your bucket list? What else are you aspiring to or do you want to achieve in what's a pretty lengthy career left to go?
Oh, gosh. I mean, look, I suppose it's just to continue, taking on opportunities that come. I've really enjoyed taking on the various clinical trials we have. Of course, the clinical trials are becoming more and more complicated, and we're seeing novel drugs that perhaps companies becoming braver to try. For instance, starting to see CAR-T, solid cancer trials. So that's, for me, really exciting to be able to be part of something so futuristic and that may really have an impact on patients in the long run. So that is something I'm looking forward to. I suppose I'm just looking forward to being to continue being involved in TOGA and to sort of take on as many opportunities as there are. Certainly looking forward to being involved at the international level and to continue being involved at that level as well. And there's still a lot to achieve, I suppose, Mel, for both my clinical and a non-clinical career as well. So yeah, just keep, I suppose, riding the wave and see where we land. I suppose I've had sort of a plan, or rather I've had ideas of where I've wanted to go. But as I've alluded to, there are certain points that I feel were very accidental. Is not the right word, but maybe purposely accidental, if you know what I mean. So I guess, for instance, I never thought coming back to Australia I would have much of an interest in small cell lung cancer. It just really wasn't in any part of my thought process. And now it's probably one of my biggest areas of interest. So I suppose just being flexible and just going with the waves and see where we land.
Yeah, I think that's a good way to approach it. And I've heard other people say that I guess when they're building their careers, saying yes to everything is a good thing, because you never know what it's going to open up. And, sure, there's a little bit of luck, but there's a bit of just being right place, right time, and being willing to put your hand up, like the small cell study, for example. I'm guessing you're going to be first to put your hand up for the CAR T studies, Surein, if you haven't already.
Well, actually, I suppose I can say that we will be opening a CAR T small cell study in a few months, and it will be the only site in Australia, is my understanding. So that will be quite revolutionary and, frankly, quite scary.
That's amazing. Congratulations. You'll nail it.
Yes, thank you. I'll need the luck for sure.
Surein, it's been fantastic talking to you. I've learnt a lot. We've had chats before, but you've done so much in a relatively short space of time. It's going to be really inspiring to our listeners, and you are no doubt already mentoring people, and people are going to be looking to you for advice about their careers. So thank you for taking time out of a very obviously busy schedule to chat to us on the podcast today.
Oh, anytime, Mel. It's been a pleasure. And yeah, look, I mean, I think that having come through my career and having some really strong mentors who have made a difference to some of my decision making, I really strive to being able to provide that for the next generation. At the end of the day, as you know, we have one life, right? And it's not a very long life when you think about it. And, the way I look at it is that if I can leave behind a legacy, and what I mean by that is that a whole bunch of people who can have great careers and do great things, that would be something that I would be particularly proud of.
That's a perfect note to end on, Surein. Thank you again.
Thank you.
So that brings us to the end of this episode. Thanks again to Surein for joining us today. And as always, thank you to the listeners for listening to TOGA's Conversation in Lung Cancer Research. If you enjoy our show, please rate and review us on Apple Podcasts or Spotify, and look forward to having you back here for our next podcast.